Our final session today is our session on brain health and Brain Health Scotland. And I would just like to spend a moment just introducing my colleagues to you about this, but perhaps just to say a few words about where this has all started and what it is we're trying to achieve without taking the thunder away from my colleague's presentation. But what I would like to say is that we've always been committed to the concept of prevention. And let's be honest, I think we've never really had enough strong and clear evidence of where and how we should tackle this. That was until 4 or 5 years ago. At that point in time, you know, the Lancet review, the commission that told us there were significant opportunities to actually prevent several forms of dementia through modifiable risk factors. We were very, very fortunate at that point in time because Professor Craig Ritchie had come back up to Scotland. He'd set up the Centre for Prevention in Edinburgh, working closely with obviously his colleagues in psychiatry and working closely with his colleagues at Edinburgh University, but also working very closely with ourselves and the Scottish Dementia Research Consortium. Craig and I were fortunate enough to meet with our First Minister. We were able to explain to the First Minister these developments and the thinking that was around. And we were able to receive from the First Minister and subsequently from many other Scottish Government officials and indeed sort of colleagues, the support to establish Brain Health Scotland. And that's a partnership that's hosted by Alzheimer Scotland, and we make a significant contribution, but the main funding for it comes from the Scottish Government. And I think it's a really important point to say that this is probably the first country in the world with a government-funded, government-led, government-supported brain health initiative of this size and scale. It's a truly world-leading opportunity for us, and it's a true step forward in the right direction and fits perfectly with the vision that I outlined earlier for what we would like to see in terms of our whole pathway for people living with dementia. So with that in mind, colleagues, I would like to ask you to actually welcome someone to the podium for the first time today. My colleague Anna Borthwick, who's the Executive Lead for Brain Health Scotland, and Anna's been doing a fantastic job laying down the foundations for brain health in the first year. So I'll just step off the platform and allow Anna to come up and take it from there. Okay, thank you, Anna.
Thank you very much, Henry. It's an absolute privilege to be here today, and I'm so excited to share with you some of the work that we've been conducting at Brain Health Scotland over the past year. I'm going to spend around the next 10 minutes or so describing that work and outlining the priorities that we've set for ourselves before introducing my colleagues, Dr. Jenny Waymont and Stephanie Adams, who are going to go into a little bit more detail about some of the engagement and research projects that we've launched in the same time as well. So for those of you who may not be familiar with our project, it's been kindly introduced to us by Henry Simmons just now, but Brain Health Scotland was established last year as a team within Alzheimer Scotland, as Henry said, in partnership with the Scottish Government. And our mission is to reduce the incidence of dementia in Scotland over the next 10 years. Working in partnership with a range of stakeholders, we aim to broaden the conversation about brain health across the whole life course, to inspire people to think about their brain and to consider ways that they can protect and improve its health throughout life. We know now, as Henry's outlined, that the diseases that cause dementia begin decades before symptoms appear, and that there is a window of opportunity, particularly from middle age onwards, in which people can make changes to reduce their risk of disease. We hope to bring that brain health mindset to life in Scotland, and I'll share with you now how we intend to do that. So these are our core objectives as for our kind of government core work. I apologise, this is a slightly dry and text-heavy slide, but it's helpful just to outline the main areas that we work across. The first one relates to public policy. We want to see the principles of brain health and dementia prevention across public health, clinical research, and in the NHS. The second is that we want to look at public understanding. We want to provide people in Scotland with all of the information, advice and support they need to promote positive brain health in their own life and in the lives of those they care for. We also want to work, obviously, in the healthcare space, and we're leading a change in our healthcare services to engage people, and that includes patients, clinicians, practitioners, with the concept of dementia prevention. And finally, as has already been mentioned and highlighted in our earlier session on joint dementia research, we know that research is at the heart of a better understanding of brain health. And we want people to help people in Scotland to join that effort and take part in programmes that will change how we manage brain health in the future. So this is our team as it stands at the moment. We're about to welcome some new colleagues to the group. So hopefully, if we're invited to come back next year, we'll be able to share a bigger slide with a broader team. But as Henry's alluded to, our director is Professor Craig Ritchie, who sadly couldn't join us today. But he continues his work with the University of Edinburgh, leading the Centre for Dementia Prevention there, and works with us to support our work here as well. Henry joins us as an associate director, and then in our core team as well, we have Jenny Waymont, who you'll hear from in a second as our research officer, and Neil, who's our project and communications lead. We're embedded within the wider Alzheimer Scotland family, and I would just like to take a moment to thank that family, both the staff and the friends and stakeholders of Alzheimer Scotland who have welcomed us so warmly over the past year. It has been, for obvious reasons, quite a challenging year to join an organisation and to look at new public health initiatives, but we really couldn't have been welcomed more warmly, and we're so very grateful for that. If anybody listening today or watching online has any questions about our work, please feel free to get in touch with any one of us, and we'll happily provide more information and answer your queries. And now I'm going to go through a little bit of the work that we've been doing in our first year since we were set up last summer. Much of our work rests in the public understanding of brain health and engaging people with the concept of preventative healthcare. So before we began designing any of our approaches, we felt it was vital to explore the current levels of awareness in Scotland and how people perceive these issues right now. So last year, we conducted our first brain health attitude survey in partnership with Ipsos Mori, and we polled a representative sample of 1,000 people across Scotland who were aged 20 to 49. We asked them initially how much they consider various aspects of their future health, and found that people are broadly as concerned about their brain health as they are about their risk of heart disease or cancer. We also wanted to explore the levels of optimism people have for being able to make changes about their brain, how much agency they feel in modifying their risk of disease. The good news is that the majority of people, around 78%, feel there is either a great deal or a fair amount they can do to influence their brain health in future. However, when we asked people if they had already taken steps to protect their brain, the majority felt that they either hadn't taken any steps or didn't know if they had. Indeed, 1 in 4 people could not name anything they could do or avoid doing to protect their brain. This opens an opportunity for us to step in and to increase understanding and to help people to know about the modifications they can make for their brain health. When we presented people with some of the known risk factors for brain health in later life, we found that many people were not aware of the connection between, for example, hearing loss, social activity, and air pollution and brain disease. But there is now a growing body of evidence, as Henry's alluded to earlier with the Lancet Commissions, that some dementias are indeed preventable. That Lancet Commission report on dementia prevention, intervention and care was updated in 2020 to include 12 modifiable risk factors that impact our brain health. Unlike family history and genetics, these factors in principle can be modified to reduce our risk. And if added together, the authors of the study conclude that the incidence of dementia could be reduced by up to 40% if these factors were eliminated. We are now working to bring this research into practice in Scotland so that this knowledge is spread widely and understood by the public, policymakers, practitioners and clinicians alike. Which leads me to the development of our brain health services, which sit at the heart of the Scottish model for brain health. One of our key activities over the next 5 years will be to develop brain health services, which give people access to risk profiling, early disease detection, and personalised prevention plans. Essentially, these services are set up to answer the question for people, what is my risk and what can I do about it? Our vision for these services is to be community-based and housed within Alzheimer Scotland resource centres, which you'll find on high streets and community centres all across Scotland. They will provide a first port of call for information about brain health and lead on to a new clinical pathway developed in partnership with the NHS. This pyramid explains how these services fit with our broad vision that runs from public health programmes, which you'll see at the bottom of the slide, which are offered to the population at large, right up to a personalised approach that serves the individual. We're developing partnerships at every level of this pyramid, running through education programmes from primary school onwards, through to awareness-raising partnerships with large employers, food producers, sporting associations, and other organisations that can influence change. And Stephanie will speak to one of these a little bit later on. By raising awareness in this way, we hope to reach people in their daily lives and invite them towards our services, which will begin with brain health hubs in Alzheimer Scotland resource centres. This slide outlines how these hubs will operate in practice. We plan to begin establishing these hubs in the next year, where people can come if they have concerns about their current or future brain health. Trained staff will be able to offer a range of assessments and advice, as you can see here, discussing our BMI, possibly sleep, our diet, any smoking habits or issues around social isolation. And those advisors will provide onwards referrals where necessary, either to our demonstrator sites, which I'll explain in a second, or to their GP if they're not in an area where we have a pilot service currently. There will also be an open invitation to anyone who would like to get involved with research studies as part of our effort to improve participation rates. If you would like to find out more about these hubs, or indeed to share what you feel would be helpful for us to offer in them, please join us at our follow-on session this Thursday, and you can find more details about this on the Alzheimer Scotland website. These brain health hubs will feed into a new innovative pathway that we're establishing in partnership with the Scottish Government and the NHS. Now, this slide looks rather complicated, but I'll talk you through the patient journeys that we've outlined here. Starting on the left, the community walk-in service will begin in a brain health hub. It's really crucial to us that this is an open, accessible service that people can come to on an opt-in basis. And the brain health hub is outlined there close to the left-hand side. If after assessment a person is deemed to be at a medium or higher risk, they will be referred onto a brain health service where they will be seen either by a nurse or a consultant depending on their specific risk. This would allow for more detailed cognitive and biomarker assessments, possibly brain scans and blood tests, to determine their risk profile and design the very best personalised prevention plan. If the time comes for new disease-modifying medicines to be introduced in the NHS, this would provide a good environment in which to understand who would gain the greatest benefits from those treatments. We're currently working with the Scottish Government on establishing a programme of demonstrator sites to test and prove this pathway, and we will of course share news about these services as they develop. Lastly, I wanted to share with you the work that we've begun in terms of sharing this message with the wider public. Firstly, we've developed a free online learning course that is open to anyone who would like to know more about their brain health and dementia prevention. You can find it on the Future Learn platform and go through the videos and reading at your own pace. We're also developing a suite of targeted training programmes in an effort to take this understanding to daily life. We're working with a number of corporate partners on workplace training and with Community Pharmacy Scotland to help shape the role that pharmacists can play in this broader conversation. One of the programmes we are most excited about is our schools programme. We're soon to welcome a new colleague to our team who will lead this work, and we hope to begin piloting a primary schools programme in the next year to get children and their parents excited about brain health. We'll of course be sharing news about this as well. As well as many of the other elements of the Alzheimer Scotland family, we've been working closely with the members of the Scottish Dementia Research Consortium to showcase the expertise we have in dementia and brain health in Scotland. You can find a new expert hub on our website, which can connect you with experts in all areas of research, policy and practice. So please do take a look if you have specific areas of interest. As part of that work, you'll find our FAQ on the news about aducanumab, which Terry Quinn alluded to earlier on in the day, a potential new drug therapy that attracted a lot of media attention earlier this year. We've gathered expert input to answer the most common questions about the drug, and we hope that you'll find that useful. Finally, I wanted to post our contact details here, which you can also find online. If we've sparked your interest today, or you would like to know more about our work in any way, please don't hesitate to get in touch. So now I'm going to pass over to my colleague, Dr. Jenny Waymont, who will talk you through some of the early research work that we've been conducting so far this year. Thank you.
Hello, I'm Dr. Jenny Waymont, and I'm going to be talking to you today about some of the work that we've been doing around current clinical services that are already in place throughout Scotland for anybody who has a cognitive complaint. So I'm going to cover what we already know so far about these clinics and the services that are already available, and I'm going to talk a little bit about some of the methodology behind some of the work I've been doing just over this summer just gone, which relates to a survey of current clinical services. So what we already know, memory clinics, and this is true of Scotland, and it's true of kind of the West, definitely, and around the world. They initially rose in the late 1980s. And this is only about 70 years after we first had a description of Alzheimer's disease, so we were a little bit slow off the mark, maybe. They weren't really developed in a uniform way. They mainly arose from clinicians who had a special interest in Alzheimer's disease or in dementias, or in a special interest of clinical academics, or they arose in response to local needs within the local community. And these clinics became much more common in the late 1990s, and this is probably due to the introduction and the approval of medicines that treat cognitive symptoms, so things like acetylcholinesterase inhibitors, memantine. As it relates to Scotland specifically, there are very few published papers on memory clinics, cognitive clinics, dementia services, however you want to refer to these services in Scotland. There were some studies done in the early 90s, early 2000s. That was a study of the British Isles, memory clinics in the British Isles. In that, only 2 Scottish clinics were included, so that didn't really give us a lot of information about how services operate in Scotland. Slightly later, we had a survey of Scottish clinics that was sent to clinicians working in memory or cognitive clinics, and that reached 18 clinics. And as you can see, both of these, well, all 3 of these studies are quite dated at this point. So we really did need to look at refreshing some of the information that we have and the information that's publicly available about these clinics. So in the spring of this year, I sent out some freedom of information requests. Anybody can do this. You basically get in touch with the health board, the freedom of information officer, and you ask them, here's some information that I'd like to know about your services. They decide what they're allowed to share with you and what's best not to share with us. We were very fortunate in that all of the health boards were very responsive. And from those responses, we found that there are probably about 58 cognitive or memory clinics throughout Scotland. One of those 14 health boards said that they use a person-centered approach, so they didn't give us any information about a specific team base or a clinic location, but we do know that clinical services are provided in that health board. And there was only one health board who reported that they don't have memory clinics or dementia services within the health board, and that was not from a mainland health board, that was one of the islands. So now I'm going to tell you a bit about the work I've been doing over the summer to kind of refresh some of this knowledge and bring us kind of all up to date. So Anna's just told us about kind of our vision for Brain Health Scotland and improving brain health in a community. We also hope to work really closely with the existing services. We've got no intention whatsoever of replacing those services. So we really need to know what's already happening, what's already out there, what's available for people with cognitive complaints, and how can we best fit in alongside that and work alongside these cognitive clinics. So it's really a benchmarking exercise. It's, as I've just said, to kind of bring us all up to date, find out what's going on. What if I walked into a clinic tomorrow with a cognitive complaint, what's likely to happen to me? This is really useful as well for putting patient experience in context. So we have a lot of research on patient experience of how they interact with these clinics. But if we don't know kind of the broader context of what they should expect, then it's quite hard to fit that research into that context. This is also really useful for the economic situation. It's useful to know what kind of staff are used in which areas. Do certain areas need maybe a bit more funding to help upskill some of their staff or recruit in new different types of staff? It's also really useful to know what kind of investigative materials are being used. So are they using MRI scans? Are we using CSF testing? That's spinal fluid testing, blood tests, all those kind of things. And perhaps most importantly, from my point of view, is that this is really an opportunity for clinics and clinicians, clinical staff who've gone through a horrible slog of the past year and a half to just have a say, like this is what works for us, this is what isn't working for us, and just to have their voices heard as well. So this census, we're calling it the Scottish Cognitive Clinic Census. Just important to note at the beginning that funding was received for this work through Biogen and the Chief Scientist Office. I'm employed by Brain Health Scotland, and we're supported by Alzheimer Scotland. So we ran a small pilot run of this census, probably in the spring of this year, I think it was, and that really informed the national rollout. We asked a ton of different kinds of questions, figured out which ones were the most important to the clinics, which questions we needed to really ask most importantly, and then we narrowed that right down. It was run as an online survey. Sampling was done through word of mouth or snowball sampling. So as I've said, if we don't really know where all the clinics are, it can be very difficult to know what your response rate is going to be. So we contacted clinicians that we already know, and we used our partners within Alzheimer Scotland who have Alzheimer Scotland dementia nurse consultants who will work in these clinics or have colleagues in these clinics. So we're really, really valuable in helping us get this census out there. We used a really loose definition of a cognitive clinic or a memory clinic. This is just to make sure that we kind of reach more of a broad range. We basically asked for services that provide a clinical assessment of individuals with cognitive concerns. So that would cover psychiatric services and neurological services and the community mental health teams. Within the census, there were 3 eligibility or screening questions. There was 20 main questions, and then at the end, there was a few questions about the clinician's experience of filling out the census. Would they do it again in future? Those kind of things. And overall, it took about 10 minutes to complete, so it wasn't very intensive. So the eligibility questions asked, firstly, is the clinic located in Scotland? That's what we're interested in. What's the postcode of the clinical service or of the team base if you're not operating out of an actual clinic location? And does the clinical service provide clinical assessment of individuals with cognitive concerns? The main part of the census involved quite a few different areas. So I said there was 20 questions. Out of those, there are about 71 individual factors, so a lot of information out of this census. The broad areas are: where is the clinic located? What type of clinical service is it? So that could be, is it a cognitive clinic? Is it a post-diagnostic support clinic? Is it a clinic for young onset dementias? We asked, what's the average age of patients coming into your clinic? Which types of dementias are commonly diagnosed within a clinic? Who staffs the clinic? Is it psychiatry-based? Is it neurology-based? Do you have clinical psychologists on staff? We also asked, how do the clinic engage in research? We gave them a few different options of, here are some different research activities you could take part in. Do you do any of these? And then finally, which clinical investigations are used? So do you do genetic testing, which is less common, brain imaging, which is very common, blood testing, and cerebrospinal fluid testing as well. So the census closed, I think, 10 days ago. So we've got some response rates hot off the press for you today. Before we get into the actual response rates, this is kind of a bit of a nerdy aside. You have to clean the data, right? So you have to check, are all the responses what we expected to see? Did anyone provide a duplicate response? So a duplicate response would be a clinic who maybe started the census, left, came back to it later, filled out the eligibility again. So I've got 2 eligibilities, but only 1 service there. There are services where multiple different clinics operate out of one area, in which case there would be duplicate postcodes, but that would be reasonable. We'd expect that. So we go through all that process. And at the end of that, we had 53 responses that were accurate and eligible. 10 of those were partial. That means they only filled out the eligibility questions. Are you in Scotland? What's your postcode? Do you provide a cognitive assessment? And 43 of those were complete responses. So that means that 81% of responses were complete responses, filled out the whole census. 72% were based in urban areas as opposed to rural areas, and 79% of the services were based in more deprived areas as opposed to less deprived areas. Those data were derived from the postcode that we asked for in the eligibility question. Again, another nerdy aside here, I'm really sorry, but if you're going to compare a subgroup to another subgroup, you have to check that there's no differences there. So we did that. There's no significant difference. So people who filled out the full response, there was no indication that they were more likely to be from, say, an urban area than a rural area than people who only filled out partial response. Just kind of check that through to make sure there's nothing biasing why some people would fill out the full response as opposed to only the eligibility. And there was no significant difference in those measures. So of the people who provided a full response of those services, there were 43. We received at least one full response from every health board in Scotland, so that's 100% reach. And we received at least one full response from 28 out of 32 local authorities, which is an 87.5% reach. Of the 43, 74.4, so 3/4 were in urban areas, and 60.5% were in more deprived areas. So I've given you the response rates, told you a bit about the nerdy data cleaning and kind of the behind the scenes processes that happen. What's happening next is I'm going to take all of those data, all those 71 different factors that we've got. I'm going to see how they compare across the country. So, for example, you could ask, do urban areas use brain imaging more than rural areas? Or do less deprived areas engage in research more than more deprived areas? So we can take all those different factors, all those different grouping variables that we've collected, and we can get some really nice, very detailed, very robust, up-to-date data on the current clinical services in Scotland for people with cognitive complaints. I'm just going to predict a question here. We asked people to respond as their service was in 2019. So obviously there's been quite an impact on services in the interim. Probably waiting times will have increased, referral rates will have increased. All of these things will have been affected by the pandemic and by that reduction in access to services. So this was all based on how the clinic would have been in 2019. And I'm aware that there is research ongoing in different academic groups about how the pandemic has affected clinical services since then. So we'll have some really nice data coming out very soon. So with that in mind, all of the clinics who provided information, who filled out the census, we gave them the option of, would you like to see how your clinic compares to other clinics in Scotland? We'll do that anonymously. So that's going to be done by October. And then data from this census, the overall project will be published, we're hoping, in early 2022. And so I think that's it from me. We'll be having questions at the end, but my email address is there if you want to note that down. I'm very happy to take any questions or comments in the interim. So now I'm going to be introducing Dr. Stephanie Adams. He's going to be telling us about brain health in sports communities.
Thanks very much, Jenny. All right, so good afternoon, everyone. As Jenny said, I'm Dr. Stephanie Adams. I'm a researcher, psychologist, and educator specializing in the sport and physical activity domain within the field of brain health, with particular focus on TBI or sports concussion. So over the next 10 to 15 minutes, I'm going to lead you on a brief journey into 3 areas in this space. There are a few FYIs, as well as a few areas I hope will encourage us to think about the role of physical activity or exercise. So to begin, we'll explore why sport, exercise, physical activity is a critical part of our brain health toolkits and why it's more accessible than we might think. We'll also briefly speak to a couple of ongoing opportunities or projects focusing around sowing the seeds in early life. So thinking about to the future of our brain health, the younger generation, and ways of planting the seed, focusing on physical activity and its benefits. And finally, we'll provide a snapshot from the world of sport and a few things that are in the pipeline from the BHS team. So 3 years ago, while working on a physical activity and data literacy project, I found myself working with pupils and teachers in Edinburgh region. And what we've learned from our fieldwork in schools sparked both a curiosity and a bit of a concern, actually, around potential limited understanding of what physical activity, along with its health benefits, mean. So we saw this mindset in a way where there was perhaps a lack of understanding or perhaps an opportunity for us to intervene. This was a concern that we wanted to address because regardless of age or health condition, if we struggle to see activity as a barrier, as being relevant, as being interesting or accessible to us, naturally it becomes more challenging to buy into it or take action. What we've learned, and also across the country, is that many young people often immediately think of just sport or PE class when we talk about our physical activity or exercise, almost as if they're synonyms. Many of the young people didn't realize, for example, that choosing the stairs over the lift will contribute to their health and well-being, or how good walking is for us instead of being in the car. This limited way of thinking about our activity can set us up to miss opportunities where we could achieve good health outcomes and support our brain health, so focusing on enhancing moments of activity on a daily basis. And even when we're young, this is really critical that we start to plant those seeds and look at what those barriers are if they are there. So it's important we continue to broaden our thinking and our awareness, importantly. So we talked today a lot about messaging, and language is really important, and messaging around physical activity under that brain health umbrella is also very important. Behavior change can be challenging. We know this. The perceptions and habits around our activity behaviors begin in our younger years. And there's evidence to suggest our activity levels and behaviors track from childhood into adulthood. This said, it is well known that the benefits are accrued, although they're accrued over time. It is never too late to gain health benefits from taking up physical activity. So in other words, it's still not too late to take action. Now, what am I talking about when I'm using this term physical activity? It's defined in the national guidance as any bodily movement produced by skeletal muscles that requires energy expenditure. So it's quite broad, actually. And it's known to take many forms and occur in many settings, so not just the gym or the pool. Things like gardening, yoga, walking or wheeling to school or work, and sport all present really beneficial opportunities. And increasingly, the science shows us that there are opportunities for many of us to get moving more, and a lot more frequently as well, and that's critical. As we know, dementia is often used as an umbrella term or an analogy to describe the symptoms occurring from brain diseases that may lead to conditions such as Alzheimer's, for example. As mentioned earlier, though, sport has in many ways started to become an umbrella term or synonym for exercise, PE class, when maybe we could extrapolate that analogy you mentioned there to this area of physical activity or exercise, starting to encourage younger generation in particular to think and talk about describing sport as one of those modes under the umbrella of physical activity or exercise. Because by focusing on all of the different ways we can achieve more movement and activities through our day, and from a young age, we can make activity more accessible and achievable. And this is certainly a position we've started to see in recent years at both national and international level with the CMO guidelines, for example. But what are these known benefits to our brain health that come from sitting less and moving more and breaking up our sitting time? And why should activity be a very critical part of our brain health toolkits? We see an excerpt here from the CMO guidelines. It says the evidence to support the health benefits of regular physical activity for all groups has become more compelling. In adults, there's a strong evidence to demonstrate the protective effect of physical activity on a range of many chronic conditions, including coronary heart disease, obesity, and type 2 diabetes. mental health problems, and social isolation. So interestingly, within this short excerpt, a number of the known modifiable risk factors from the Lancet Commission, for example, for dementia, those risk factors that are highlighted on the screen there, they're mentioned here. So movement really is medicine. It can is one tool that we can use to help think about ways of hopefully lifting and supporting in this space as well. We can take things one step further and see that the dementia itself is listed in this graphic from the UK Guidance on Physical Activity. If we look at that middle column with the red arrow. So physical activity or exercise is a key tool that can be having beneficial outcomes on the risk factors that may lead to dementia. So it helps tick many boxes. So it's supportive of our brain health. So I flipped that umbrella the other way, thinking of physical activity as one of those really critical tools to support that brain, and thinking about the fact that we now know that lack of physical activity is a modifiable risk factor for dementia as well. So there's increasing evidence to support that focusing our efforts on continuing to increase physical activity literacy, so our understanding of what physical activity and exercise is and how much we should be doing, but also our behaviors through education will be a key part of increasing our understanding and utilizing this in our toolkit as we age and go throughout the course of our life. Working with sport can be a great gateway to this, and we'll talk a little bit more about this later. But also a sport focus doesn't need to be it for everyone. Not everyone is interested in sport, and that's absolutely okay. But we know that there are a number of different ways to get involved in movement that can achieve those benefits. Scotland is a fantastic place to work in this space. Just one local and recent project I mentioned earlier from our colleagues at Edinburgh, so that project I spoke to about working in schools. So this is the DataFit project that I work on, led by Dr. Samantha Faulkner and Professor Judy Robertson at Edinburgh. I have no doubt that the project that Anna mentioned in the pipeline for work in schools at Brain Health Scotland will complement this fantastically. This particular project, DataFit, is a Scottish Curriculum for Excellence MAP project that focuses on empowering young people and their parents, teachers indirectly as well, to better understand their own physical activity and personal health data, as well as the safety around this, which is key, and also to identify the ways in which they can move more and sit less throughout their daily lives, including whilst in the classroom. And importantly, it focuses on teaching young minds to think about how they feel, how they think, and how they act on days they move more compared to those they move less. And just to explain that Scottish Curriculum for Excellence a bit more, if that's a new term for you. So this is if we think about the frameworks and learning outcomes that teachers are encouraged to hit in the learning outcomes across different subjects. So this is one that helps to achieve that and covers a number of different learning outcomes across the curriculum. So the hope is that collectively through projects such as this one, that increasing good literacy and action around the subject, we're hoping to sow the seeds that underpin good brain health as we become adults. And I think this is really important in terms of the link to dementia prevention and supporting brain health and thinking to the future. Recall that there's some evidence that physical activity levels track from childhood into adulthood. There's also evidence that shows that activity levels often begin to decline as early as adolescence, around the S1 age, particularly amongst girls. And we must pay attention and intervene on these trends to keep us moving and supporting our brain health through activity. All right, so shifting into a few things in the pipeline. So in recent months and years, there's been emerging evidence in parallel with an overwhelming amount of media attention on the potential link between sport and later risk of neurodegenerative diseases, often talked about in the context of a history of traumatic brain injury in sport or concussions or repeated brain injury or subconcussive impacts. Now, this whole area could be a talk in itself. And for the purposes of today, what I hope to get across personally is that while as a concussion researcher myself, I fully believe it's critical we continue to focus on improving evidence-based concussion prevention and education strategies, I also support that we must not lose sight of the other modifiable risk factors of poor brain health as we age. So we need to think broadly and not get focused just on the traumatic brain injury element. Also thinking the fact that many positive brain health benefits and skills that come from safe lifelong participation in sport and physical activity, including after retirement from sports or when we may stop activity for various reasons, which is a key time for intervention. So again, education is a critical pillar in all of this, and something that the BHS team have been working on, and which leads me to close off by mentioning a few things that are in the pipeline. So over the last few months, the team and a number of brilliant colleagues have been working on a project with sporting organizations that will be released soon. Hope to be able to speak to that today, but it will be soon. And this will include dissemination through the BHS social media channels and mailing lists. So do stay tuned, and we'd love for you to take a peek and share through your networks when this comes out. Off the back of the success of the dementia preventing dementia MOOC that Anna spoke to, that's on Future Learn, development is underway to add to the collection, including leading on a course relevant to sport. And we'll be looking for subject experts and end users to be involved in that next phase of co-creation soon. So involving the end users and the stakeholders in that sporting context as we go and evaluate it. Neil Fullerton at BHS here, with a little bit of support from myself, has been leading the development of a new landing page as well, where information, resources, and services relevant to the athletes and their networks will be coming. There are some perhaps tailored opportunities to support athletes, particularly those approaching retirement from elite sport or in retirement already. So there's an opportunity to tailor to that group. And this page will be ever evolving as we continue to learn more from the science and also from those using the site, importantly. And the hope is that this will hopefully go live very, very soon. So there's much more to come and update you on very soon. But I just want to take a moment to thank you all for listening. We are, I believe, now going to shift to the panel discussion, so I won't take questions now, but thanks very much, and great to have you tuning in. Thanks very much.
Thank you, Stephanie. And we do have some time for questions to the panel as a whole, but just as Stephanie's taken a seat there, I'll just say thanks for 3 fantastic talks, and there's loads of exciting initiatives in the pipeline, so I have to keep track of them all closely. And I think Alzheimer Scotland Conference 2022 will have a big update on a lot of these things that will have launched by then. So it's really exciting times. And I suppose just before we delve into questions, and please do keep your questions coming in online, those watching at home. We've got time for some questions now. But General, and I want to start off with for the panel. Stephanie talked there at the end about working with sporting communities, and Anna talked about building partnerships across sports and across nutrition and education. And I just wondered how, perhaps this concept, which is maybe fairly new for a lot of us out there, this concept of brain health, how that's been received so far across those communities when you're reaching out to people to talk about these concepts of prevention of brain health, if that's something that people are engaged with, or if there's any barriers there at all. Maybe Stephanie, starting with the sporting community.
Yeah, thank you, Neil. Great question. So interestingly, over the last few months, there's been a lot of co-creation work in the background of the project we've hinted at. And one of the trends that I've noticed is that they're in even communities such as the healthcare professionals in sport, a lot of the athletes, I'm noticing a trend where when we're speaking about brain health, actually there's a shift back to focusing on concussion. So there's a lot happening in concussion. There's a UK parliamentary inquiry a few months ago that's happened over the last year. So it is, I think, at the forefront of our minds. There's a lot happening there, but there's a really fantastic opportunity to be introducing this concept and laying that groundwork and correcting that misperception early as we go. And it's quite positive as well to be thinking of and educating around the other risk factors. We need to, there's individualization elements and things, and still a lot to learn for athletes, but noticing that opportunity really to help give hope and thinking about what we can take action on to tip things in our favor, hopefully.
Okay, so, and Anna, have you found a similar kind of positive reaction to talking across these sectors, or what's your been experience?
Yeah, I mean, I would say it's been overwhelmingly positive. Actually, we've, as you've alluded to, we've kind of been reaching out to the areas where we feel organizations can influence change. So as you said, kind of in the nutrition space, they're working with supermarkets and food producers, but also in terms of education and looking at our schools program. And I think what's been really fantastic to see is the way that people have embraced elements of Alzheimer Scotland work to date in terms of making environments dementia friendly and for people to understand dementia and how to to support people living with dementia at the moment in society, and they see our work as coming along really to complement that, to be alongside it, and to broaden that conversation, as we kind of alluded to earlier, to look at the whole life course. There seems to be a huge appetite around people wanting to understand more about the risk factors, about how we can all make decisions and changes in our life that can modify our risk to some extent. Obviously, not all of the risks are very easy to meet and tackle, but we've found the reception to be incredibly enthusiastic, which is it's just been fantastic.
Excellent. Okay, well, long may it continue.
Yeah.
And I suppose leading on from that, great to hear positive reaction, and going to our questions here that are coming in. A couple of questions coming in from Yvonne and David, which I'll mush together into one, which is basically asking how can we get involved. So how can people get involved with the work of Brain Health Scotland? What can they do?
Oh, what a fantastic question. The favourite question of the day. That is brilliant. Thank you so much, first of all, for sending that in. I think probably on a purely practical level, so we have our Brain Health Scotland website, and if you log onto that website, you could find on your search engine, there'll be a pop-up to invite you to subscribe to our newsletter. So we produce a newsletter, regular newsletter, that will have all of the information about our programmes and any kind of upcoming opportunities. We certainly have engagement opportunities in terms of developing our projects and our programmes, but also we're going to be looking for individual volunteers as well to support some of our particular activities. So we'll publicise all of those opportunities through that newsletter. So that would probably be the first port of call. And obviously all of our contact details, please feel free to get in touch with any of us if you have a specific idea or are working in a particular setting that you feel would work well with this agenda.
Okay, excellent. And I'll jump in there with a little plug as well, which Anna kindly mentioned, which is that we are running a follow-on session on Thursday. So this fantastic programme of follow-on sessions that Alzheimer Scotland have arranged. We have one on Thursday all about these brain health hubs, which Anna introduced. And Brain Health Hub is really using this amazing infrastructure that Alzheimer Scotland already has, and how we can embed brain health messaging and advice and assessment into that. And we're really, really keen to get people's opinions on it, and what you would like to get out of a service like that, what would work, what wouldn't work. So it's hopefully going to be a really interactive session on Thursday, where we're going to ask your thoughts on some of our plans and how we can build those for the future. So register for that via Alzheimer Scotland website. Yeah. The other question we've got coming through here is more of a comment really from Willie, just saying around the wording around memory clinics can be a bit of a misleading term. And I suppose that comes on to your work, Jenny, in that you're reaching out to all these different cognitive clinics and asking them to fill in the information. So I wonder if there might be a way of unpicking from your data that you get back how people refer to their clinics, if they call themselves memory clinics, if they call themselves cognitive clinics, or what. That might be an interesting question to.
Yeah, that's a really interesting point, and it's something that's raised a lot. So we know, and particularly within Brain Health Scotland, we don't think of dementia as a cognitive disease. It's not a problem with how you're thinking. It's very much a neurodegenerative disease. It's to do with the biology of the brain and the neurodegenerative processes that happen. One of the questions in the census did ask, how do you describe your service? Do you describe it as psychiatry outpatients? Now, unfortunately, I did roll these into one. So I did ask, do you describe it as a memory clinic / cognitive clinic / dementia service? So I can't really disaggregate that data. And I think next time we run it, that's a really good point. And I would probably ask that in a slightly different way. What I will say as well is that in the conversations we've been having over the summer with clinicians, with people who work in these services, people who call them memory clinics, this is a very broad generalization here, but the people who refer to them as memory clinics tend to be clinical academics. And that's kind of just a legacy of how we describe these services in the literature. Most of the services are actually based in community mental health teams, which again, it's not really a mental health problem, but those are the teams that do the work with patients, whether it's assessments, diagnostics, or whether it's post-diagnostic support. That'll generally come from a community mental health team. So I use the term cognitive clinics, which again, not really a cognitive disorder, but it does affect your cognition. But no, that's a really brilliant point. Yeah.
And the other, just while we've got you there, Jenny, the other thing I want to pick up on there is it seemed to me like an absolutely fantastic response rate that you got, especially comparing to what existed in the literature already. And you said that previous study only had 2 services across the whole of Scotland, and you've got this amazing input into it, it seems, at what would be a really busy and difficult time for clinical services in this last 18 months. So fantastic that they engaged so much. And I just wondered if you had any insight into how you manage that, or any tips for anyone else out there, how you got such a good level of engagement from, is it just that people want to share what's going on and they want to be involved? Or?
I have no idea how that happened. We just got really extremely lucky. I tried to word, when we were recruiting clinics to take part in the study, I tried to word it in a way that takes about 7 minutes to boil the kettle and wait for your cup of tea to be ready. And that's pretty much how long it takes to do the survey. So if you wanted to do one while you're doing the other, this is kind of a bit Machiavellian, but my background is in psychology, so it's pairing those behaviors, right, to try and optimize the response rate. But generally, the clinicians are really interested. This is data that's really useful for the clinicians and for the clinics themselves. So they want to contribute and they want to share. And part of the census is about developing best practice and sharing best practice. So a lot of clinics were really keen to discuss, and there was a big comment section at the end. We asked them to respond as if it was 2019. What was the state of the services before the pandemic? And then in the final comment section, we asked, do you have anything that works really well in your clinic, or is there anything that's really challenging for you at the moment, particularly with regards to the pandemic? As you can imagine, a lot of people said the pandemic is a problem, waiting times are a problem, referral times are a problem. But there was a lot of people who provided really good insight into, well, this is how we've run the clinic in the past. This is what worked really well. We've changed some things slightly recently, and we're not too sure if that's still working. So yeah, I think people were just really, really keen to share. And it's been fantastic, actually, looking at some of the literature from across the world as well. The response rates generally range from about 30% response rate to about, I think 86 is the highest. That was a study in, I want to say, the Netherlands. So because we use snowball sampling and all this, is quite difficult to get an actual response rate, but we reckon ours is probably about 88%. And if we think there are 58 services identified through those freedom of information requests, we received 53 responses. So that's a very high response rate.
Yeah, fantastic. Another world-leading initiative in Scotland. So that's great. We look forward to the result. You've laid out all the methodology perfectly there, and we look forward to seeing the results and what we can tease out of that. Another question just come through here now from Louise around who will be the people providing the assessments and the advice within brain health hubs. And I suppose this is all yet to be completely finalised, Louise, which I would encourage people to attend the session on Thursday. We really these are the kind of things that we really get into a discussion around and what people think. Anna laid out the vision for the brain health services that kind of go into the NHS side of assessment and advice, and these brain health hubs kind of sit almost slightly before those NHS services. So while the NHS services will be staffed by clinical staff, the NHS hubs wouldn't necessarily be so. But it's yet to be kind of all refined. The brain health hubs hadn't launched yet, so it's yet to quite be all refined. So we'd really welcome input into that, and who you think should be there and should be offering support in those hubs. So yeah, more to come on Thursday for those that can join us. And Stephanie, I just to change tack slightly, I wanted to pick up on something you mentioned in your talk around sport and exercise, which was around athletes approaching that retirement age and coming out of sport and coming out of that rigid lifestyle. And I just wondered if that might be a particular time that you'd be trying to get across some of these messages, and if you feel that that people are particularly well prepared for that transition at the moment, or if there's more we could do there.
Yeah, no, great question. So we have a number of colleagues, and we've had some really great conversations around this. So this is, information I've learned from those that we collaborate with, and I guess there's evidence, growing evidence, that we know that some athletes, in particular, there's sort of this period of transition. Like many things that we take on throughout our lives, but athletes are, as they're approaching retirement, they're perhaps in a vulnerable position. Some to that there's sort of increased risk of their metrics changing that we know impact brain health. So sort of weight, blood pressure, sometimes increased alcohol consumption, risk of mental health, things like this. You particularly elite level, going through all these changes. 2 weeks ago, I think I was speaking with a former swimmer who, they were handed meals 3 times a day and said, here's your kit. So they're very well managed. Not all teams, we can't broaden, but there's just the sporting world is very fascinating. It's ever evolving, and there's a real opportunity to look at how and if we can support better through that transition, and thinking about also the tailored aspect of that as well that Anna hinted.
Yeah, fantastic. No, it's brilliant work. So we're coming to the end of our time here. Any questions that we didn't get time to answer just now, apologise for that, but Anna's given me all the contact details for Brain Health Scotland, so please do get in touch when we didn't cover today. Thank you so much to our panel, and I'll hand back to Henry.
Well, thank you very much, Neil, and thank you. That was a wonderful presentation, and I hope everyone walks away today inspired and full of hope for our work in Brain Health Scotland, and indeed all of our work across prevention and education.